Let's talk about PlasmaPen. The PlasmaPen is a small handheld device that uses radio frequency energy to produce a potential difference between the needle on the end of the device and your body. And this potential difference, when the needle approaches the skin and doesn't quite touch it, this potential difference stimulates an arc that happens between the end of the device and your skin, and that arc that happens is a thing called a plasma. Okay, it's an intense energy. It's a very, very, very high temperature, but it's a very, very brief little spark, which creates very, very localized, intense mini burn, if you like, on the skin. This allows you to create tightening of the skin, and you can be very localized exactly to where you want the skin tightening to occur. You can do the dots in a particular line to allow the tightening to happen in a particular line as well, so that you can pull in a particular direction. It is, of all the things that I do, probably one of the most marking. You certainly can see little brown dots where the burns were created immediately afterwards, and they can take upwards of a week to go away, sometimes a little longer, but certainly upwards of a week to go away. And therefore, of all the things that we do, it's certainly the one that creates the most visible marking, and therefore you do kind of have to avoid being seen for a while afterwards, up to about 2 weeks. But it's certainly, because of the technology, is comparatively cheap, and therefore we can do a PlasmaPen treatment substantially cheaper than, for example, any of the other radiofrequency treatments that we do, like the ultrasound, and also the laser treatment, the Fraxel. And therefore it's a choice that can be made for people for whom the budget is an important aspect of their choice. PlasmaPen is very good. It's comparatively pain-free. We do use a really good, strong local anesthetic cream on the face to numb the face substantially before we do the treatment. Again, I wouldn't want anybody to think you wouldn't feel anything. You certainly feel a little something, but it's not too bad. I've never had a single patient run out in the building screaming, so it's obviously not that bad. But yes, it is uncomfortable, but relatively brief, and then you're left, as I said, with little rows of dots on the skin that can take a few days to go away. But in terms of quality of result, it can certainly result in a very nice superficial tightening of the skin. It's very, very good, particularly for example, the upper eyelids. So it produces what's called an upper blepharoplasty in a way that is certainly substantially cheaper than any form of surgery, and certainly substantially cheaper than the other radiofrequency and laser treatments that we offer. But equally, you do have to put up with the marking. The marking does go, and the skin looks very good afterwards, but certainly for that transition period immediately following the treatment, it can be quite substantial. PlasmaPen, it's a really good alternative treatment for the kinds of things that we can do for patients. Thank you.